first aid kit. So those would be things that you could easily just tuck into the one if you don't want to buy individual supplies. I like it because then I get to choose what brands do I like, and I'll highlight a few of that. What method of delivery? So do I need a chewable? Do I need a dissolvable tablet? Do I need a liquid? So depending on the age of your kids or who's in your household or where you might be using it, you can adapt it. And so I tend to choose to do that as an individual versus trying just a big kit.
Hi, welcome. I'm Dr. Stewart.
I'm Dr. Gordon.
And today we are going to talk about first aid kits for home use. But this is a really important subject because I know for a lot of parents, especially when there is an urgent need or anything, that we have to be the voice of reason and the calm ones. And by making a kit, it can help facilitate that, so you know exactly where to go for certain kind of conditions or scenarios. And Dr. Gordon brought a kit that she's made that's super cute and helpful. So we're going to kind of go through that in more detail. But I really feel like in any sort of emergency, definitely call 911.
Yes.
I mean, but this is really more for more minor injuries or concerns. And so that way you don't necessarily at 3 a.m. have to run around your house and be really stressed to organize and to calm the kids down or to calm your spouse down or anything like that. It was so funny whenever we were just organizing for today's event, I realized that I have some of my first aid books with my books in my house. And then I had certain things upstairs, certain things downstairs. And I realized this probably doesn't make a lot of sense. So just simple preparedness, I feel like is so essential. So now I'm like, okay, I'm going to put everything in one spot.
Yep.
So that's my first advice. Be prepared and definitely put it all in one spot. So I think other just kind of general overview for being prepared is making sure you have appropriate phone numbers.
Yes.
Yeah. So maybe having a type out a little list and then include it in your kit as well.
Yep.
So phone numbers, what would be some examples?
Yeah. So
besides 911.
Yeah. Emergency contact, what your preferred hospital is, who your pediatrician or healthcare provider is. So that way, in case you are in a situation where you don't feel like you can answer questions, that you have something in one place and you can just hand it to, whether it's the EMTs or fire department or the babysitters, everything's all in one place. So at our house, we have a binder that is next to our first aid kit that has everything in there. It has our emergency contact number for when my kids who have allergies, it had what their list of their allergies was, what their symptoms, it had the Benadryl dosing handout. And so everything's just all in one place. The other really big thing, and what I think I might add as a resource now that we're talking about it, is just a checklist of all of the things that we're recommending that are on here with an expiration date, because that's something that I experienced recently. And I think I have shared on prior workshops or webinars, is that one of my kiddos had an allergic reaction to kiwi, and the Benadryl I had on hand was expired. And it still worked. I still gave it to her, but it made me it was that reminder to myself of, okay, just because I have certain things doesn't mean that I can just leave it and forget about it until an emergency happens. And so we now have kind of a system in place to be able to say, all right, let's check our expiration dates. But maybe that would be helpful to put in there as just a
very good idea.
Cheat sheet, make all of our lives a little bit easier.
For sure. And that's what I'm so glad that you're attending this, because we're going to try to streamline this whole kit and process for you. Because I know a lot of people are like, oh my goodness, I don't even know where to start and I feel behind. So definitely use the tools that we're providing for you and feel free to grow them too and individualize based on you and your family's needs.
This can be adapted. I have, a larger one that I have at my house, and then I have smaller versions for in the car or sporting events or those types of things, to where I feel like at least I'm a little bit more prepared. So I'll kind of walk you through not only what to have as our bigger option, but what are the things to really have on the go in the car or when you're out and about.
Can you first show us your beautiful kit here? It's so cute.
So what I love about this, so I bought it on Amazon, and what I love is that you can choose how many layers you want, and then you can grow it. So the one that I initially started with was just a 3-pack, and so it was just this top section here. Okay. So top section has a carrying handle, so I can just carry it. But then I've been able to add on of different layers. And so I've actually sectioned it off to by condition or how I want it to be organized. And then my plan, which I haven't done yet, but I'm planning on doing, is getting out my fancy label maker so I can just say, all right, here's my allergic reactions, here's my pain medication. And so you can organize it whatever makes sense for you, or whatever, if you like to be organized like that versus just having things in one thing, that's totally okay.
You know, but what I
do love it.
Thought, so clearly our personalities are showing here about how I think this is like the coolest thing. No, but at the top section, you could have like your travel.
Yes.
Like, you know what I mean? And then you just unclick it and you're like, okay, I don't need to take this on this family trip kind of a thing. And then just take the top 2 or whatnot.
Yep.
I definitely know when I've prepared different first aid kits is that I have one kit and then we outgrew it. And then I had another one, and then I never knew what was in the other kit. And it was just, it was hard to stay organized. So that's why I love this, is that you can just kind of grow it.
Yep.
Can you share that Amazon link for that? So that way we can find that and access that.
And you can buy packaged first aid kits in whatever size you want. What we wanted to do a little bit differently is add in a few extra naturopathic alternatives or things that I think that are good to have on hand that aren't necessarily going to come in a first aid kit. So those would be things that you could easily just tuck into the one if you don't want to buy individual supplies. I like it because then I get to choose what brands do I like? And I'll highlight a few of that. What method of delivery? So do I need a chewable? Do I need a dissolvable tablet? Do I need a liquid? So depending on the age of your kids or who's in your household or where you might be using it, you can adapt it. And so I tend to choose to do that as an individual versus trying just a big kit. Okay. But I do love it. And it traveled nicely. So let's talk through some of the individual scenarios when you might come into a time where you're going to need your first aid kit, and then what you want to be able to have. So in one of my layers, and I think it's at the very bottom here. Oh, nope, I mixed them up now. So a lot of us are going to have experience with cuts, scrapes, maybe lacerations where you're wondering, oh shoot, does this need stitches, or how do I clean this really well? So in every first aid kit, I always want you, even if it's your own family, have access to gloves, because that way you're not having to worry about cleanliness or what germs are on your hands. So it's not only about protecting you from that individual. If you're working on somebody outside of your home, so say it's in a neighborhood barbecue or a play date, you always want to make sure you have gloves. I like to store these in little individual baggies, so that way it is staying clean. You can grab them, put them on. So gloves, definitely a must there. And then we'll have things like our antiseptic wipes or towelettes. These can dry out if you let them expire. So these are going to be one of the other ones of just saying, all right, let's make sure we keep those in place. We also will have our just non-sterile gauze. You can also split this up. So say you buy a really big package, split it up into a couple of different kits. So that way you have some, but you don't need all of it. But these are just little sponges to where if you need to apply some pressure to a cut or a scrape, or you want to put on some Neosporin or another herbal antibiotic cream, then you can do that, cover it up with a gauze before your Band-Aid or your tape. So Neosporin, I have a love-hate relationship with. It is easily accessible. It's inexpensive. There are some people who are going to respond negatively to it. So Bacitracin is one that you can also find over the counter. I tend to keep one of those, or you can buy little individual packets, but Neosporin is pretty generic. The other one that I like is Active Skin Repair. That one comes in a spray as well as a cream. So that's where we could add in some of our herbal or naturopathic options there too. Then we're going to have things like our tape. So say we need to, it's a bigger one, it's on the knee. So you can take one of your sterile gauzes, apply that to the wound. And then rather than trying to organize Band-Aids over it, you can use your tape. So it's just an adhesive tape that you can then apply that bandage to. I keep a little pair of scissors in here, so that way I can cut that tape to size. And then Band-Aids and whatever. I have just some generic ones in here, but you can find some pretty kid ones if you want, but you can, various sizes. It's good to have some various sizes in there. Things to take into consideration, and when you're not necessarily just reaching for your first aid kit, but you are either calling 911, you're calling your healthcare provider, you're taking your child to the ER urgent care, is if you have something that is not stopping bleeding, regardless of how much pressure you're putting on, or if it is a deep wound to where you can see various layers, the borders are very irregular or jagged, those are going to be times where it's going to be really beneficial to make sure that you are taking your child to be seen or evaluated to find out whether or not they need stitches. You can also put in a wound care, like a spray.
Yeah.
Yep. What were you going to say?
Well, and then there's also the little strips.
Yep,
too.
steri strips.
Yeah.
Yep, or butterfly Band-Aids. So those are another really great option in terms of like, what are the various sizes of Band-Aids that we want to have available? Mm-hmm. Those steri strips are really nice to where if it's just a really tiny cut, but you want to keep those edges together, you can again use your scissors and you can cut that to whatever the size is that you need depending on the area.
One thing I was just going to mention is that I've always been told that if you do need stitches, I mean, by all means, go to wherever is accessible for you. But if you have the option, if it's on the face, to actually go to like a plastic surgeon. So that for that tidbit is maybe take the extra time or on your emergency contact list, maybe know of an emergency plastic surgeon.
Yep.
But I've heard that time and time again when it comes to more facial lacerations.
Or other sensitive areas. Chest, things that are going to be really
visual.
Yes, exactly. So your local children's hospital, and most of the time they are trying to bring, or they'll have access to a plastic or a big trauma hospital. Tricky part with that is that if you have a younger kiddo, they might not be as, not equipped, but they might not have the same bedside manner at a big trauma hospital than they are going to have at like local children's hospital. But yes, not be afraid to be your child's advocate and ask, say, I would prefer not to have a resident do this, or I'd really prefer to have a plastic surgeon come in and do this evaluation to see what's necessary. Or ask, does this truly need stitches? Instead, can we glue it? So there's something called Dermabond. And so that is also an option too, to where but it has to be a particular type of lesion or laceration to be able to use that. But that is something that can be a good option. With scars, while we're talking about our stitches, there's lots of really good creams that you can put after stitches have been taken out to decrease scarring. And then that's a time, especially if it's on the face or somewhere that is going to be sun exposed, applying sunscreen regularly to decrease scarring. But little side tidbit there. So that I have everything in that category in one little tray. So that way I know, okay, if there's a cut, a scrape, I can just grab this whole section and I have everything that I need in order to be prepared for that one. Then we have our stings, bug bites. I'm going to hand that one to you. Thank you. Stings, bug bites, all of those types of things. And that one is going to come in. We're going to use things like our Benadryl, whether it is a Benadryl cream, maybe we need to, it's super itchy. Maybe it's not even necessarily just a bad bug bite, but it's super itchy. A Benadryl cream can really be helpful. Maybe they're showing signs of allergies, whether it's a bee sting or just getting red, you can do something like a Benadryl. So Genexa, this is a newer brand. So what I like about it, it's naturally what I look for in brands, whether it's Tylenol, ibuprofen, or Benadryl. I want it to be dye-free, and I want it to have as least as preservatives as possible. So that's what I love about Genexa. It's a newer brand, so you can order them online. You can find them at Target, a lot of Rite Aid, other pharmacies. So it naturally doesn't have any dye in here. And then it comes with like the dosing on the very top. So there's a couple, you'll see them a couple of times here in my first aid kit. So this one is a liquid Benadryl. So if you have a younger kiddo or somebody who can't swallow capsules or tablets, having a liquid option is a really great idea. And then also having an adult dose of Benadryl. So you'll see this one is all the pink dyes, but it's a great option in terms of an emergency. And then we have things like our other herbal options. So all-purpose salve, I'll use that for certain bites. It has calendula, it has comfrey, vitamin E, vitamin A. So it's really soothing. I'll also use this in a separate little subject or scenario too.
Both my kids. So we use that at our house for like probably too many things.
Yes.
Yeah. And both my girls know that as boo-boo medicine.
Mm-hmm.
So they'll ask for, can I have some boo-boo medicine? And that is our boo-boo medicine.
Yep.
It's an all-purpose salve like this.
I love this one. Yeah. There's another one, same brand. It's called Wild Weed Salve. Mm-hmm. It isn't in my kit right now because we used it all and it's currently on back order, but it is a really great option. That one I love for more itchiness. So mosquito bites or perfect to put in this. Yep, perfect to put in this one. Biggest thing with any type of bite or sting, watch for signs of allergic reaction. Mm-hmm. And so that's not only when we're using our Benadryl, but this is a time where if they're showing any signs or symptoms of anaphylaxis, you're calling 911. You still want to administer that Benadryl first, but then you want to let that healthcare provider know, or the EMTs or fire department that comes out, what dose you gave them and how long ago you gave it to them. This came into handy, my travel first aid kit recently at one of my son's baseball games because one of the players got stung by a bee. And while he wasn't allergic, he does tend to have a really big irritation. He gets a really big rash from it. So I had a travel Benadryl cream and we had Benadryl sitting next to us just in case he started progressing and showing a worse reaction. But it was nice to be prepared and it definitely came in handy. So that one, they also make some different sting creams. They make ones that are in like a liquid that you can dab on there. So these are not exhaustive lists. You can choose what has worked well for you and can just continue to add to your first aid kit. Thank you. Mm-hmm. The other thing that I have in this section is going to be in case there was something that was in the eye. So there's a foreign object, there is some dirt, there's some dust. Trying to get it out without putting your finger in it is going to be huge. So a couple different options. I like to have a big one. So this is just a sterile eye drops. And then I also like to have little ones. So these ones can be really nice if you feel like you just need a couple. I like that they're individual, so that way I can just toss it out. I keep some in my car as well, not just for contacts or those types of things or dry eyes. These are really great to help to flush the eye out. So that one is a really great option as well. And then even though we were talking about stings and bites, hives come into this category too. So the same things that I was mentioning with the stings or the bug bites, again, making sure that you have that Benadryl on hand at home. This may come into play when you are first introducing solid foods to your 4 to 6 month old. I tell every new parent, I want you to have not only Benadryl on hand, but then have that Benadryl dosing handout. So in case your child does have an allergic reaction or breaks out to hives during the initial introduction of foods, that you're prepared and you feel confident to be able to know exactly what you're going to do about it. So again, that's where it comes into that liquid Benadryl formulation.
I also want to add too that there's homeopathic remedies too that you can use in emergency situations. Well, emergency situations, like while you're waiting, if help is on the way. But anyway, this book I like. It's called Help in Homeopathy. And for all the different scenarios, it can give some of the top homeopathic remedies to consider. So apis for bee stings, and there's a lot of different quick remedies. Arnica for bruising, and definitely that can help speed up the healing and the recovery time. That, I guess we could definitely always add to these kits itself, but personally at our home, we have a separate homeopathic kit to access there. But at least maybe even having a printout guide or just a book right next to this, so you quick reference what would be the top things.
Yep. So arnica, I think, should be a part of every single first aid kit. It works so well. So I normally use a different brand, but when I was adding some things to this kit, Genexa that I was just mentioning, and I have no financial affiliations with them at all. It's just that they also now have an option for arnica. So I use this a lot at home, both in the pellets. So these are little dissolvable pellets that can go right in the mouth. So you can use them pretty much at any age, but then also an arnica cream. My son plays a lot of baseball and he's constantly getting bonks and bruises. And I've taken before and after pictures, 1 dose of not only oral arnica, but then putting it on and seeing what happens overnight. And every single time it gets better. It's just amazing. So having some sort of a oral arnica and then a topical arnica, and it comes in various forms. Maybe it's not just arnica by itself. Maybe it's in a combination cream. So Dr. Stewart has an option there too.
Yeah, this is just a pain cream. And that's one of the top ingredients is actually arnica, but it's in combination with some other things there too. One thing too, since we're just talking about arnica, is that for any procedure, I always recommend having like 2 days before, the day of, and afterwards to help speed up recovery and decrease bruising. I see a lot of patients that need to get fine needle aspiration, especially for their thyroid nodules, and that definitely can help as well. So keeping arnica in the household is something.
Yeah. Prior to a dental procedure, especially so for kids. Yeah. It's definitely a really great one to have on hand. The other thing that I have in this section, so we talked about kind of bonks and bruises. So definitely the arnica, like we mentioned before, having some instant cold compresses. This, you may not think of trying to go find something to put ice, or maybe you don't have a baggie. So these are great because all you do is you squeeze it to pop it. Definitely have one of these in your travel kit. We have one of these again. You're hearing me talk a lot about baseball when it comes to injuries, just because that's where life is at right now. So these should be in every first aid kit, not only at your home, but in your car on the go. So these are really great options too. With cold compresses, you want to be mindful not to put it directly on the skin because you can irritate the skin too much. So having a simple barrier, whether it's a piece of clothing or a paper, paper towel, something to where there's just a barrier in between there. The other thing that you might find is that if there is not just a bonk or a bruise or something like that, you might end up needing to take out a splinter. So playing at the playground, playing in the backyard. I like to have really fine scissors, or excuse me, not scissors, tweezers. These are going to be ones that are really, really fine needle. I keep it in the package until I need it just for cleanliness, but really fine tweezers. And then I like to keep just a little bottle of hydrogen peroxide, just again, kind of clean that area before and after taking something out.
And also good for if blood gets on any clothes or whatnot, hydrogen peroxide to the rescue.
Yes, absolutely. When it comes to falls, bonks, those types of things, we get these phone calls a lot at our office. My kiddo just fell off of the changing table or rolled off of the couch or those types of things. What I tell parents is that your kiddo needs to be seen if they fall off something over twice their height, or watching for signs of concussion. They threw up afterwards. They have blood coming from their nose or their ears. In older kiddos, if they seem disoriented, they don't know what happened either right before or right after the fall. They feel like their balance is really off. Or if you just have that parental intuition of something is wrong, those are times where I say, yep, definitely need to be seen. They can't move their arm. So a nursemaid elbow can be really common. But definitely if it's over twice their height, or once they're taller, over 6 feet, those are automatic reasons where they just need to be seen and be evaluated.
Great.
The other thing having to do with splinters, if it's embedded, you're not able to get it out, then that would be a time where we might end up having to numb that area, or you might need assistance helping with restraining that kiddo or that individual to be able to get it out, making sure that all of it was taken out instead of a fragment that got left in place. So those would be times where we would say, yep, you need to be seen. Most of the time that can be done in a primary care setting, but depending on how upset the kiddo is, that's going to depend on where I would have you take them. So a lot of times we're not going to do anesthesia or a topical anesthetic, an injectable anesthetic, or a nasal sedative in an office setting, because you have to monitor them for such a longer period of time. So that's when we'd be sending out to urgent care or ER, certainly in the middle of the night. Other ones about tick bites. We don't you probably don't get a lot of tick bites here.
No, but it's important, unfortunately, to recognize, be aware of, remove properly.
Yeah.
Because Lyme disease is pretty terrible.
Yeah.
Yeah, I do. I mean, in general, if someone has a tick bite, and I'm all about natural medicine, trust me, but that is one situation that especially if forming a rash, that I think that there's a time and a place for an antibiotic like doxycycline.
Yes.
So I would say contact your provider, because I just feel like, unfortunately, I've seen so many patients on the other side have struggle with chronic Lyme.
Yeah.
So the more that we can get ahead of it, and then also if you have it, even store it in a bag, so then identification of what type of tick that is, you can send it out for testing. And there's different tricks to remove a tick. Sometimes tweezer helps. I've heard of the lighting on fire. Don't do that, because then you can just burn yourself in the process. And then
and then still be embedded.
And then careful too, because when you pull it, make sure the whole thing, because definitely there you can take off the body, but not the head there too. So there's plenty of YouTube videos too. But just know the importance of if you have a tick bite too, and to check all crevices, hair, whatnot for ticks,
especially after hiking. Say you go to a location that is more prevalent with ticks or tick bites. Part of that process after your hike is to go through and do a check to make sure there isn't anything that is present, not only in yourself, but if you have animals, because you want to make sure you catch them as early as possible. Like Dr. Stewart was mentioning, it's really important to make sure that you're monitoring for rashes after a bite, or especially a tick bite. So if one forms into almost like a bullseye or a target lesion, automatic reason that you would want to make sure that you're contacting your healthcare provider.
For sure.
Yep. The other one that I have in here, so pain, fevers, those types of things, I like to keep a good old fashioned thermometer in my first aid kit versus relying on either a forehead or an ear or one of the other fancy thermometers. So I like to have a good old fashioned one, because it's going to be reliable in the case of
a battery.
Exactly. Yes. And then it can be used in various ways. So this can be used orally. It can be used under the arm. It can be used rectally. So it's really great to always have a backup thermometer in place. And then I have various types of pain reducing or fever reducing medication. So again, here is that same brand, Genexa. This is a Tylenol that comes with a liquid formulation. So a little dosing syringe here, and then Tylenol in pill form. And then I like to keep aspirin on hand at home as well. And you can have ibuprofen. Yep. So this one is the 81 milligrams. So the baby aspirin. And so I like to keep various types on hand, because you can alternate ibuprofen and Tylenol if needed for pain. So Tylenol can be given every 4 to 6 hours, whereas ibuprofen every 6 to 8 hours. So you can, what we call, piggyback them. You can alternate, especially if you're having a hard time keeping pain under control, or if we need to suppress a fever. Not always do you have to suppress a fever. A fever is not always a bad thing, but if you are needing to, then having something available. So that one is there. The other thing I like to have in my first aid kit in case of emergencies is going to be a CPR mask. That is a single use. It is completely disposable, but it is a way to protect you in case you needed it in an emergency. So it comes in just an individual case, and then it walks you through how to use it. So this one is a good one to have on hand, not only at home in case you have a guest or somebody over that you're not wanting to do mouth-to-mouth or CPR without a barrier. And then a couple things that I don't have in my first aid kit, but I think that would be useful or to consider. So choking, there's a couple of de-choking devices. There's one called De-Choker, and then there's another one called LifeVac. And that one I do have at home, but could not fit into my first aid kit here. But that one, it can be a travel option if the Heimlich isn't working or there's something really embedded. It is a mask that goes over the nose and the mouth, and then this suction, plunger to be able to bring something out. Have you seen them before? Yeah. So it's not, I don't think it's a necessity, but if you're feeling like, I just want to make sure I have everything available in my first aid kit, those are other things that I would end up considering as well.
And I know next month's event, we're going to also be talking about fire safety.
Yeah. Or just home emergency.
Right. So something else too is that I'm sure he'll probably talk about is maybe even like one of the ladders, having something like that if you have, a 2-story home.
Yep.
So more to come.
Yes.
But this is really great. I'm pretty sure like you would be a dream if any Thanksgiving event, I'm inviting you. We're like, you're on the invite list. But family. I'm just thinking family gatherings, sports events.
Yes.
I mean, and going through this, I think it also, I think it's cool, but to have your friends or other fellow mom or dads to just have an event to be like, okay, we're going to make one of these together.
Yeah.
So then it's like, okay, you order these supplies or I'll order these supplies and we'll split it and just make a date out of it.
Yeah.
So,
I love that idea.
Or a neighbor too, because then you'll know what they have.
Yes. Yes. And then you can share supplies. Like we were saying, you might not need the whole package of something. And then you can share ideas on, all right, when would I need to use this? Or, hey, let's practice what this looks like, or just being frankly prepared for it. The last thing, so on this kit, it has this little removable tray. I'm still trying to figure out how to organize my top layer here, but some of the things that I like to have in here are going to be electrolyte powders. So in case there's an episode of vomiting, you don't have to be running out to the store to try to find some Pedialyte or Liquid IV or those types of things. Elementi is one of my favorite brands. Again, no affiliations there. What I like about this is it doesn't have any sugar in it. It's stevia, but it's primarily salt, which is what you need in an electrolyte replacement. The other one that I really like, so Elementi Pure Hydration, that one's coconut water based, and that one is fantastic. And then the other one I like is called Hydrant. So all of them come in individual packets. I take these with me all over the place, not just in my first aid kit, but with workouts or hikes or those types of things. But I like that they're in individual packets. So that way they store really easily. The other
nice to put in your purse too.
Yep.
When you mention Pedialyte, there's also, it's called Kate's Farm. Have you heard of that brand?
I haven't.
Yeah, there's some really good options on there as well.
Yeah.
So check them out, especially if just needing, if not able to eat and acute vomiting and just not able to keep anything down.
Yeah.
That could be a good option to keep it in the household too.
Yes. Lots of good alternatives to Gatorade. Gatorade should not be the first choice electrolyte replacement. It is not my favorite. It's very widely accessible, but there are lots of really good other options.
Other things too, especially if having a lot of GI upset, especially when traveling or diarrhea, is having some sort of like activated charcoal. This is one complex that I love and recommend regularly, and thankfully really pretty inexpensive. This one's called GI Detox. And this is a combination product of activated charcoal, zeolite clay, aloe vera, apple pectin, humic acid, and fulvic acid as well. So this might be something too good to travel with.
Yeah, absolutely. And then one last one that I was thinking of that made it onto my list but didn't make it into my first aid kit is nosebleeds. Nosebleeds are super common. One thing about that, you do not want to do the old-fashioned lean your head back and pinch your nose, because then you're going to be swallowing all of that blood that then is going to upset the stomach. That can lead to then vomiting. Instead, you do want to lean forward and pinch the top of your nose. But I like to have something like Afrin. Afrin is going to be a spray that you can use. You don't have to spray it up the nose. You can apply it to a Q-tip and apply it that way. Also really good for other cuts. So say there's a cut in the mouth. Really common one is upper lip ties. So if it's not revised in infancy, those oftentimes kiddos are going to fall, they're going to hit their mouth, and there's going to be a lot of blood simply because blood mixes with saliva and it looks a lot worse. But those gauze pads that you have in your first aid kit, you can put Afrin on there and you can hold it in the mouth on that upper lip to help with stopping that bleeding. And so that's another really great option, because they look really scary.
That happened to my daughter actually recently, who cut and had a little laceration on her tooth, and it just bled. And then poor thing, she like looks up at me and her little face, and then there's just blood completely covering all of her teeth. And I could thankfully I knew everything was going to be just fine, but definitely a lot of, bleeding. Yes. Something, speaking of Afrin, is I think a lot of people think of Afrin as being kind of more of a decongestant, for nasal spray, but it's a bit of a vasoconstrictor. So that's why this is helpful with small bleeding. I definitely can use that. And then there's also styptic little pencils there too, that you can include in your kit as well. well.
Yeah. So with bleeding, again, just kind of precautions. If that bleeding is not stopping within 10 minutes, that's an automatic reason we need to have somebody be evaluated. There could be an underlying condition that is contributing towards that bleeding. That wound could be bigger or deeper than you might have thought that it was. And so if it's not stopping, good reason to be seen. Same thing with nosebleeds. So if it's not just a cut or a scrape, but if that nosebleed is not stopping, then sometimes you end up having to have something cauterized to stop that bleeding too. Other considerations. So we talked about anaphylaxis. We talked about target lesions. We talked about falls, open fractures. Hopefully that is a pretty obvious one, but if you see an open fracture, they definitely need to be seen. If they're not able to move their arm, then somebody should be, or other parts of their body, they should be seen. When it comes to rashes, that's another time. So say you're using the boo-boo cream or the all-purpose salve or a wildweed salve, and that rash is just not getting better within a couple of days. That's also a really good time to say, all right, let me contact my healthcare provider, because there could be other reasons for that rash. Yes.
Especially if getting a fever, and if it's really red, it could definitely be infected and need a little bit more aggressive treatments as well. I also just have to, since we're talking about different preparedness, is don't overlook the fundamentals, things like helmets. Yes. And, seat belts and, car seats. And, I just, it's
wrist
one of those
guards.
Things that, wrist guards. Shin guard. I know. No, it is important, and to make sure everyone and the kids know where they located. And then for us, we've similar to having expired products that you want to make sure to update, is making sure that they fit.
Yes,
because those little kiddos' heads they grow, and so I know definitely there's been times that I've been like, oh yeah, we need to get some new helmets, and making sure that everything fits. Because if they don't fit, all the more reason kids are going to be like, oh, I don't want to wear this.
And replacing them if they're cracked. So we recently learned, we went to a bike shop and I was asking a lot of questions about helmet fitting and how to choose the right one. And he was explaining that once it's cracked, the protection declines so much. They recommend, and not just from like a sales standpoint, but an actual protection standpoint, to replace it. Just like if you get into a car accident with your car seat, then we recommend replacing those, because then it no longer holds up to the safety studies that they originally did when they were passing that particular device. So lots of things to keep track of, but hopefully these types of things are helping you to not have to completely start from square one, that you have some tools to be able to say, okay, here's my list of things that I need to start gathering or purchasing, and just making your life a little bit easier, even if it's just one step at a time.
Yeah. Helping you sleep at night, not worrying about this. And that's really, the intention of why we're offering this event is really helping streamline this for you all.
Yeah.
And empowering you and your families of just where to go. As far as other books, I know I had mentioned this Help in Homeopathy, but this one too, it's called Natural First Aid. And I really like this one as well. You had one too that you had mentioned.
Yeah. Dr. Jared Scouron, he wrote one that is all about first aid and herbal medicine or top conditions. I apologize, I can't remember the name.
All right.
Okay. Well, thanks so much.